In this episode, I welcome Nami Watanabe. She actually just finished her women's health clinical rotation with me, so she was my preceptee. Nami will share with us how it is like to be a nurse practitioner student, especially as a family nurse practitioner student, and also some resources that was helpful for her to prepare for clinical rotation. Aloha, I'm Miki Miura, a family nurse practitioner in Hawaii. I've been a nurse practitioner for 10 years and I absolutely love being a nurse practitioner and the lifestyle that Korea has given me. My passion is mentoring nurse practitioner students and new grad nurse practitioners to build amazing careers so that they can have the freedom of choice on what they want to do and how they want to live. All right, let's get into it. Thank you, Nami, for joining this interview. I'm so excited to talk to you today.
Hi, Dr. Miura.
Nami is a nurse practitioner student, specifically a family nurse practitioner student in Hawaii. And she just finished her women's health clinical with me. And she watched my YouTube videos and I asked her if she's interested in being interviewed and she accepted my offer. So thank you so much. I really appreciate it. Okay, first of all, could you introduce yourself?
Yeah, so my name is Nami. I am going to be third year FNP student at one of the universities in Hawaii. So I'm going to be a third year next week. That's going to be my final year of the program.
Wonderful. She also is originally from Japan, but you moved here when you said 15 years old.
Yeah, I was born and raised in Tokyo, and then I moved here for high school. And then I went to California to attend my undergrad and did master's in Japan. And I came back to Hawaii during COVID. And that's when I decided I want to go into nursing. I did my BSN and then I'm doing DNP right now.
So she is in an accelerated program. When the first year they focus on studying to become RN and you pass NCLEX, and then the next 3 years you focus on DNP. So what kind of bachelor degree and master's degree did you have?
So I did my bachelor in biology. And then after I finished my undergrad, I didn't know where in medicine I wanted to go into. I decided to do master's in public health because public health really gives you a holistic approach to health. So it really made me think like where I want to end up in medicine.
Wonderful. And so how I met Nami was, this makes me feel old. But I met her, I guess, when she was in high school, and she came to the clinic that I was working as a registered nurse back then. And years later, after I became a nurse practitioner and been practicing, and I saw her Facebook that she's now in FNP program. And now I was like, oh, if you are an FNP student, I'm happy to teach you as a preceptor. And that's how she ended up doing the clinical with me. So I guess I know you for a long time.
Yeah,
and
I think like 10 years.
But I just remember that we didn't spend like years and years. I think it was like, if anything, like a few months and stuff like that. But I just clearly remember you are always hardworking. And I didn't even realize that you were a high school student back then because you seemed very mature and very smart. I just had a very good impression. And that impression lasted for years and years. So when I saw your post that you are now in NP school, I was like, oh, I'd be happy to teach you. So that's amazing that you explored options for your career and you end up. So what made you decide to enter family nurse practitioner program?
So I think FNP really appealed to me because with FNP, you get to work with like babies to geriatrics. So I think I really like the broad aspect of FNP program.
Wonderful. What kind of, you have some nursing experience, and like I said, she is an accelerated program. Nami took a different route compared to someone like me who went to BSN for nursing and then just straight up, which is, you might call it typical, but then once you got RN license, you decided that I should work as a nurse to gain some experience. So what kind of nursing experience do you have?
After I got my RN license, I was trying out some nursing home, but it was not like really what I wanted to do. I always knew that I wanted to go into women's health, so I was looking some job on Indeed. But it took me a while, but I started working as a fertility nurse here in Honolulu. I get to work with women's health patient every day, which has been like very like beneficial for me.
Oh, absolutely. And even if you end up working in general women's health like I do, fertility issues is always something that women want to talk about. So having the background is so amazing. Do you think working as a nurse was helpful to go through nurse practitioner program?
Yeah, so I definitely think it's helpful to get some nursing experience. Like people say, you have to have 2 years of nursing experience. There's pros and cons to it.
Right.
I have many colleagues like who did not get nursing experience going from BSN to DNP, but they're very smart and I know they're going to be wonderful NP. So I would say it's definitely helpful, but it's not 100% necessary to get nursing experience.
I'm not too sure. Being an experienced nurse practitioner, I think what you did was smart, that I wouldn't say you have to have years experience before you enter nurse practitioner program, but I think I would recommend what you did. Once you got the RN license, then you jump into healthcare, specifically as RN, because then you start to learn how to communicate with patients. Because I've been teaching a lot of students who are in an accelerated program, and I agreed that kind of depends. Everybody's smart, but some people are in a way more smarter in terms of didactics. But I had a student, she's very smart on books, but she was struggling to have a good trust relationship with patients and communication, because nursing is a strange job that we have to be like, hi, nice to meet you. Then you just dive into, tell me about your sexual history and all that stuff. So you have to have a skill to immediately start building trust relationship. And how you do that is that based on communication skill, which is very hard to learn only through books or even through the videos and stuff. You have to actually interact with patients, and everybody's different, so you learn from each patient. So I personally feel what you did exactly is what I would recommend for students who are in accelerated program, that you might not need years and years of experience, but I think jumping into healthcare will be helpful, because healthcare is a strange, unique field to work in. It's different from if you are working at a clothing store and stuff like that. And I can see that you are my student, and I was watching you talking to patients, and you had that skill of gaining trust from your patients, and also pay attention to privacy of patients and understanding how they react to your words, and you adjust how you say things or take it slower. So I think some things cannot be learned just through books. Let's move on to next question, because I was in FNP program over 10 years ago. Things might have changed. So tell me, this is about your specific program, but how does it work? How many clinical rotation you have to complete to graduate? And do you have to finish your didactic? Let's say you take didactic for women's health, then at the same time you go to clinical, or you do this first and the next semester you go out for the clinical. How does it work?
So I don't remember the exact hours, but I think we need more than 1,000 hours for clinical hours. So we do have classes like 1 or twice a week. It can be online or it can be in person. And 1 additional day to finish clinical rotation. So typically 1 or 2 days of didactic and 1 day of clinical rotation, spanning out over 3 years. I think the first rotation I did general practice, like family medicine, and then I did specialty in liver. And then I also did school-based health center for my 3rd clinical rotation. And
Which was, I bet pediatrics.
yeah, so that's considered as pediatric. And then I did women's health. And last two, we can do one elective. And school wants to like wrap it up with primary care.
Okay,
Yeah.
very good. First of all, for folks who are nurse practitioner student outside the United States, and I know in Japan, a lot of nurse practitioner students are actually not allowed to work when they are in nurse practitioner program. But you work, and I did work too, and a lot of my classmates used to work as well during program, and that's actually pretty normal in the United States, is it not?
Yeah, it is normal that school encourage us to work. But some like our classmates definitely had hard time finding a job that allows us to be like so flexible because they always want someone like who is committed to work. But in a sense, we are unreliable because sometimes we have to go to class, sometimes we have to go to clinical. So finding a job that allows flexibility was definitely challenging. But luckily for me, my manager and my workplace is so understanding. They really allow me to do that. So I'm really thankful for them. Yeah.
Okay, perfect. So because you are a family nurse practitioner student and you have to cover all the fields, I wasn't sure if your school provides behavioral health rotation, but maybe I was thinking of somewhere else. Back then when I was a student, I don't think I received much education, maybe no education regarding behavioral health. But I feel as a primary care provider, there's a good chance that you encounter behavioral health issues. And sometimes you might have to deal with it because the behavioral health providers are not available or the appointment is far away and you have to do something in between time. Did you guys learn anything about behavioral health during the program?
So we didn't have clinical rotation in behavioral health, but we had one semester dedicated for behavioral health, and that was a wonderful class.
Yeah, that's so helpful. And I wish I had that because a lot of times what happens is there are a lot of psychologists in the community, but psychologists cannot prescribe medications. So a lot of times what happens is they tell patients, oh, go to your PCP and get antidepressant, whatnot. But if you didn't get training for antidepressant, you feel very uncomfortable prescribing those medicines. You don't want to just give medicines without knowing the risk and knowing how to adjust the dosage and which medicine is more effective for certain things and not. So that's what I felt like it was lacking and I wish I had. Of course, after you graduate, you have opportunity to go to continuing education, so you can learn that on your own. But I'm so glad that it is becoming a part of FNP education because definitely, regardless of which field you go to, I think that's something that you probably will face. So was didactic always before clinical rotations or it wasn't coordinated in such way?
I think women's health is always after you take didactic, but other clinical rotations are based on what's available. But I think having didactic course completed before I did clinical rotation with you was very helpful.
And I don't know if they did it that way because I complained the last time. Because so the student took the women's health didactic a year before. So when they started the clinical, they completely forgot what happened. And because you have to move on to, okay, next is adult health, next is pediatrics, your brain has to switch off so that you can observe new information. So it's pretty hard for students to learn one thing, but then you don't do clinical for the field for a while. And then now you have to learn something new, and then your brain has to push away the knowledge that you acquire to accept the new information. And then now you're expected to have the basic knowledge about the field that you learned a year ago. Unfortunately, securing preceptors and clinical rotations has been a huge problem across the United States. So that's why this situation happens. But that can be a struggle or problem for students, I bet. So speaking of precept, we shared that how you find me, but how did you find other preceptors?
So school would generally find you preceptors. So the past 4 rotation that I did, school found it for me. But if you want to do elective and start specialty, then you can find your own preceptor, which I'm going to do for my elective. But school will generally do their best to find preceptors.
There are multiple nurse practitioner programs in Hawaii. Was it something that you consider when you apply for a nurse practitioner program?
Not really, because back then I wasn't really thinking that forward. But when I started DNP program, that's when I realized finding preceptor is a huge challenge for many students, because I think some programs will let students find their own. But luckily for us, school typically will find it. Yeah, and there is hope for that.
Absolutely. And luckily, when I was a student, it was the same way. But I think more and more students had the burden to find their own preceptors. And you already have a lot of stress from learning different subjects, passing exams and stuff like that. And meanwhile, you have to find preceptors, which is very hard. And if you are considering of going to nurse practitioner program down the road, or you're about to apply for nurse practitioner program, I think that's something that you should really consider, especially if you are online program, like maybe let's say based in mainland, but you're in Hawaii and you want to do clinical, you live in Hawaii, but you are going to this online program in the mainland, but the school don't have connection specifically in the community that you live in. They probably can't help you to find preceptors because they don't know anybody here. And that's going to be extremely difficult because you have multiple clinicals. So not only you have to find a preceptor, but also you don't want to find just any preceptor. You want to find great preceptors so you can learn a lot. Yeah, that's something that people should consider when they apply for nurse practitioner programs. Online programs may seem, it's cheaper, maybe this is a good option. But you really want to consider, if you have a lot of connections and you already say, it's not going to be a problem to find a preceptor for me, maybe that works for you. But especially if you're an international student, have no connections at all, it's going to be quite hard. I'm glad that your program had strong connection to the community. So not only that they can find you preceptors, but they make sure that preceptors going to be good teachers for you. Yeah, so I think that's extremely important. If you have any tips on finding preceptors, you didn't have to look for preceptors for the most part, but can you share any struggles? Because if for elective, you had to find your own. And your employer helped you to find preceptor. Right. You told me about that.
Yeah, but I think having connection is the way to secure a good preceptor, because as you said, you don't want to go into any preceptor who you don't know about.
Right.
So I think if you're a type of person who wants to find your own, then use your connection to find a good one.
And so speaking of good preceptor, bad preceptors, and you went through, you don't have to be specific because I don't want you to have any disadvantage, but you went through multiple preceptorships so far, and you can see different preceptors have different styles. And I'm very passionate about precepting students, and Nami can tell you that. But the reason why I'm very passionate about is because when I was a student, I only had one rotation with nurse practitioner, but the rest was with physicians. And I thought the physicians are wonderful. But when I graduated, I pretty much had no idea what nurse practitioners can do. And that was really a struggle for me as a new grad, because I've seen physicians doing so many things, but I wasn't sure. I'm a nurse practitioner. Can I do that? Or am I supposed to do that? And setting the boundary of how much, especially Hawaii is a full practice state. So we can do pretty much everything. We can even prescribe controlled substances. We don't do surgery or delivery, but unless maybe for surgery, unless you go through fellowship. But drawing like how much nurse practitioner are expected to do and how we can practice safely was a difficulty for me. I think it's very important to have many clinical with nurse practitioners so you can learn. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews well so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. So you experienced different clinicals and tell me about maybe differences. Some preceptors were this way and some preceptors were that way.
I think for me, I had really good one. For the last rotation, I really don't have any complaint or any concerns with preceptors, but I've heard from my colleague that they had some bad one too. But I think the one I had really let me think of like an NP. The other preceptor that my friend or my colleague had, they said that they didn't really learn a lot from them because they were just teaching in one way. They didn't let NP students to think using critical thinking.
Mm-hmm.
But for me, I had a really good one. And yeah.
I'm so glad to hear that. So I guess your friends were maybe shadowing the whole time and wasn't really given some kind of autonomy to come up with the plans. I totally agree. My preceptorship is not the easiest. I know that, and I do it intentionally because I want to help students as much as possible to build confidence, because being a new grad is extremely hard. Because it depends on where you end up working. But some places you're just, okay, you graduated, you have certificate, so you must be all good. There you go for it. So you might not have any mentorship, or you might have mentorship, but you still have to show that you are competent. So if you had easy clinicals during the nurse practitioner program, you probably end up having a very difficult new grad period. What are the difficulties you face during family nurse practitioner program?
I think generally speaking, graduate programs, the experience is based on how you make it. Graduate school is not gonna hold your hand and teach you. So setting a time to self-study, explore topics on my own was definitely challenging.
And which I think you did very well. So usually in my preceptorship, I usually get students to research on a topic per week or until the next clinical day, and then give me some quick overview of what they learned. I think you're right that as a grad student, you can't just show up to the clinical and expect to be told everything, because the preceptors are seeing patients just as usual. They have very busy clinic and they usually don't get extra time because you have students. They don't have a block of time to teach students. They have regular schedule, full schedule with patients to see. So they can't teach you like, okay, dermatology 101, this is called papules and stuff like that. So you do have to study to some extent. And for those who are going to start clinical rotations soon or thinking of going to nurse practitioner program, what I would suggest is ask your preceptors before you go to the clinic the first time. Maybe email, I'm very excited to work with you. Could you give me some suggestion of what topics I should review before I go? And then also another thing I would recommend to ask is resources that they suggest to use, because it depends on the field. For women's health, I have resources that I share with Nami and her classmate, that I use this book for dermatology, I use this app for birth control and stuff like that. If you can ask those questions beforehand, you have more time, because once clinical starts, especially Nami took her clinical in summer, which is the worst thing ever. Because you have, 2 months or so?
Only 8 weeks to complete 135 hours.
So it's very hard. It's very tight schedule and you have so many things to learn. But at least if you can find out, okay, how can I prep a little bit better? I think that will give you a little bit of head start and you might feel a little bit more comfortable. Other difficulties you face during the nurse practitioner programs, like stress or obviously balancing work and life, was not the easiest.
I think anxiety of where you're gonna be placed with clinical was a huge thing for me.
Yeah. And especially communication with school, and also if you go to small clinics, usually it's easier because you only have one person to talk to. But if you go into a larger organization, then you have to get checked for immunization and get trained for EMR and all that stuff. That takes a while. And then you have only 8 weeks to finish. And then you're just waiting for the process, but that's not something rare. Unfortunately, that's very common, and that's must be very stressful. I was stressed out for you guys because I was like, they want to start now. And Nami was very good at being proactive, that she was constantly in touch with them, asking them, hi, can I follow up with this? I haven't received any email. I haven't received any dates for EMR training. When can I attend that? And stuff like that. Definitely don't just sit and wait and think that somebody else will take care of you. Again, you are a grad student, so you have to take the lead, which Nami did a wonderful job, that she was always on top of it. And I was so impressed about that. Okay, let's see. So since we are talking about the work and life balance, how did you manage your stress, like anxiety?
Let's see. I definitely spend a lot of time on my hobbies, include playing piano, going to ballet class, and then play with my dog. So I think having those really helped me calm down my anxiety. But here and there, I always get anxious when I don't know the next step. When it comes to school, I still have difficulty managing it, but I think I'm getting better at it.
Very good. And being in school sucks because you also have to pass exams and there are constantly deadlines that you have to keep up with. So your program is half online and half in person.
I would say it depends on what class we're going to be taking. So this past summer, we didn't have to go to campus, but I think 2 semesters ago, we had to go to campus once a week. So it really depends who's teaching the class, if the classroom available on campus. I think there's multiple factors that determine whether it's going to be online or in person.
Which type of classes did you like better, online versus in person?
Didactic online was very helpful because it really saved me time driving to class, driving to campus. So sometimes I did go to clinical half day and then drove home to attend class online. So for me, online worked really well.
Did you develop any friendship or connection with your classmates?
Yeah. So I think going through the accelerated program to DNP, you have to have a good support of friends. I don't think I would have survived this far if I didn't have my classmate. And then we always vent on each other about what's happening with school and clinical. So I think having them really helped me get through this program.
And how did you get to know your classmates that you have a strong relationship with?
I think from accelerated program to DNP, we just got really close because we always struggle on one thing.
So is that you are in an in-person class and you just saw face-to-face and stuff like that?
So the accelerated program was strictly in person. And then we knew that who's gonna go into DNP. So I think that bonded us really tight.
Yeah, and that's so important. My friends from nurse practitioner program, multiple friends actually, we're still in touch and we grew as a professional together. And not only just go through nurse practitioner program or overcome new grad period, but there are different stages in your career, and having somebody who's actually taking a step with you is so important.
Yeah.
And I've been doing group precepting lately, and I have 2 students at a time, and hoping that it also helps students to have some kind of connections. Because once you're out in clinical, students are usually separated. And unless you actually make effort to be in touch with your classmates, you can be all alone. How did you keep connecting with your classmates?
Yeah, we have a group chat that we tend to text almost every day.
That's amazing. And for folks, like even if you are on online program and if there's no existing group chat or whatever the formats, you should be the one to create it, because that's really helpful. And I just remember a lot of times I was trying to listen about details about assignment, and there's so many times that my classmates said, make sure to do this by this day. And I was like, oh my God, I forgot. Thank you so much. And I did the same to my classmates. So we basically help each other. Because you're tired from working and going to school and you stress out. Sometimes you miss something that is extremely important.
And then I think my group of friends, one is going to Durham. She's been working as an RN at Durham office, and then she's interested in going to Durham. So I always know when I have questions for her in future, I can always count on her. The other one is interested in diabetes. So I know that I have count on that person for diabetes.
So how did you prepare? We touched upon this, but how did you prepare before clinicals? One thing I realized is you might not be able to come up with 100% satisfactory plan. But when I asked them, did you check this or what is this? And a lot of times you are able to give me answer. So that gave me a signal that you prepared. And you mentioned that you had to self-study. So how did you prepare before clinicals?
I think for your clinical, you really helped us because you gave specific topic that we should focus on. So that's how I prepped for my clinical. And then for the upcoming clinical rotation, so I'm going to do mine in primary care. So I think my goal for this clinical is to pick a system each week to focus on before going into clinical, so that I know better when I go into clinical rotation. So for example, this week, I want to focus on endocrine system, so that next week when I go into clinical, I'm going to have basic knowledge about endocrine system. So select one topic or 2 topics that you want to focus on, and then go to clinical so that you have basic knowledge instead of going to clinical without knowing anything.
And adding to that, I would recommend, because you have no control of who's going to walk in, and even preceptors, I try to schedule, if you want to do IUD insertion, thinking my students want to watch, would you like to come in on Friday? And then I was thinking like, they're going to be here on Friday. Oh yes, okay. We have to always prioritize patients' requests the most. So we have not much control over who's going to walk in. So I think adding to that, I would recommend to contact your preceptor and what are the most common conditions and that you would see, so you can prepare, so you have more likelihood of seeing the disease that you studied for. Because even if I want to study for this disease, but then if nobody walks in with that, and also I think it's very helpful to learn first and see actual case, and that helped me because I can't just memorize things. I need to have a face or memory with, oh, I remember that case. That lady had this, and I immediately knew it was uterine cancer or something like that. If you have an actual case study, then it really clicks and you can have a deeper learning with it. But to increase the chance of having that matching, that what you study and then the case actually walked in on the day that you actually in the clinic. You are not there every day. To increase the odds of having the match, you can ask what kind of disease do you tend to see? And then you can decide, okay, this week among the list, I'm going to focus on diabetes today or something like that. Especially primary care is so broad that there are so many diseases. And also be flexible. You can still learn as you go and also learn after you finish the clinical. Oh, today I saw hyperthyroidism. Let me look at that. It's no shame of not knowing. Trust me, as a practitioner, you will face, occasionally there's some cases like, I have no idea what this is. And then you go to the back and then frantically look up on the up-to-date and then just try to learn in 1 minute and then act like you're an expert. But you aren't expert. You have to learn the skill of adjusting. So that's also, I think, helpful. What kind of resources were helpful during clinicals?
Up to date.
I completely agree. And it depends on how you use. There are faster way and a more effective way to look at certain things. We practice how to write prescriptions, and there's so many information on the website, but you need to know exactly what section you need to go. But once you master it, it really helps a lot.
I really liked how you taught us to stick with few resources. Because, for example, for women's health, we focused on ACOG and up to date. That really helped me because I used to spend so many time choosing which resources that I want to look into. But having just a few resources, you can find answers there. So I think that really helped me.
For sure. So the reason I mentioned that to Nami and her classmate and other students is because if we get sued in the future, and if they ask, what are you based on? Why did you decide this? What's your resource? And if you have tens of thousands of different resources that you use it in different times, then unless you notate every single time on the note, according to this and that, I think you will be like, I'm not too sure. But for me, if it comes to pregnancy, I know that very majority of cases, I go with ACOG. So I can say, without writing it, I can say it must be ACOG because that's what I usually do. With the rest is up to date. Or if it's dermatology, this, but try to limit. And I think that's one thing about how effectively utilize preceptorship. They know the best resource because we went through different resources and try out ourselves. We realize this resource is not helpful. It's waste of money. This resource is amazing. And they can give you a recommendation. And depends on preceptors. They might not tell you unless you ask them. So actively ask them and see what they recommend. So you are the third year, you're about to graduate in 1 year.
Next May. So less than a year, actually.
Less than a year. So at this point, what kind of challenges are you facing right now?
Since this is gonna be my last year, we have to finish our DNP project. And then also we have to start studying for the board exam. So I'm actually very scared if I can manage work, clinical classes, studying for board and DNP project. I'm really worried about that. So that's the biggest challenge for me, find the time to do it.
I didn't notice when I was a student. I finished MSN, then worked as a nurse practitioner, and I went back to school into DNP program, and I was working full-time. And my nurse practitioner partner was on maternity leave, so I was seeing her patients, and I was working full-time, taking 12 credits, and it was so crazy. And when I think back, I should have decreased my work schedule because it was way too much. So always, when you are in that situation, you felt like there's no way other than just go through this. But just remember, you can decrease your work hour, or you can even take a break during that semester because having fairly good grade and also having satisfactory DNP project is so important. So unless you are in a financial difficulty, then it might be very hard to quit the job or even decrease hour. But always remember, your mental health is so important too. It's okay if you take a few months of break. You have to prioritize school and your mental health first. Yeah. What's your DNP project? What is the theme?
So mine gonna be creating a referral system for adolescents who needs sexual health services. Because a lot of adolescents, they don't want to go to get care when it comes to sexual health because they don't want their parents to find out. So as a result, the rate of STD is increasing. The rate of unplanned pregnancy among teens is increasing. So I am creating a list of all the clinics in Hawaii where they accept adolescents so that I can hand that list to school nurses so that when students come in to school-based health center, they know where they can go to get those care.
Are we included?
I'm actually doing on all the island except Oahu because
I see.
did work on Oahu. So I'm working on Kauai, Molokai, Lanai, and Big Island, and Maui.
That's great. That's great because they're rural, so their resources scattered and access care is even worse compared to our islands. It's wonderful. And the reason I asked is because we do teen clinic, so I was excited about this topic. How did you come up with the DNP project topic?
So starting our cohort, school decided to make DNP project as a group-based. So we didn't really have choice to pick our own project because they wanted us to do group-based. So I think what we did was that school gave us the list of the projects that we want to work on, and whoever is interested in specific topic chose that topic.
I didn't know that school does that to have a DNP as a group project, which comes with pros and cons, I bet.
Yes,
but
I agree.
at least it's strongly related to your interest. For you, it's a wonderful topic.
Yeah.
So that's wonderful. What's your plan after graduation?
I think after I graduate, I definitely want to find a job in women's health because that's what my heart wants. But I'm going to take whatever is available. If women's health is not available, I'm willing to spend few years in other specialty. But ideally, women's health is what I really want to end up.
Yeah. You can also convey your employer if you end up not being in specifically women's health only clinic. You can say, I'm very good at pap smear. Which was confirmed by Miki Miura, that you want to focus on women's health. And maybe they'll be like, oh, perfect. Let's say you end up working in primary care, but they might be very happy that you're interested in. So I think it doesn't harm to tell them where your passion lies in. And even if you end up working primary care and eventually find a job in women's health, having the primary care knowledge is so helpful because in women's health, we end up still seeing some diabetes, high blood pressure, thyroid disease, and all that stuff. And you might be more knowledgeable than your senior nurse practitioners who've been working in women's health, but they're not confident in primary care. So I think any experience will be very helpful. Lastly, any advice for prospective and current nurse practitioner students?
Yeah, I think just be proactive. Take any challenges that comes up to you. You gotta be strong and overcome the challenge.
Wonderful. Thank you so much for your time. I appreciate it. Good luck to you. And if you need any advice, you always know where to go.
Thank you so much, Dr. Miura.
I hope this episode was helpful for you. If you like this episode, please give me a thumbs up and subscribe to my channel. We upload new episodes every Friday. Also, if you have any requests for future episodes, please write down in the comment section. All right, I'll see you in the next episode. Aloha.